Hello, my name is Kareem Zurub and I am a 10th grade student in the Amman Baccalaureate School. Many people still do not believe in getting vaccinated, which affects all of us in the community. My project is to help people realize the importance of getting vaccinated through presenting scientific data from people in the field. For my personal project this year, I have decided to create a documentary about the importance of getting vaccinated. COVID-19 is an infectious disease that has spread worldwide. The pandemic first announced on the 31st of December 2019 in Wuhan, China, and was identified as 2019 nCoV by the Chinese authorities on the 7th of January 2020. This is a graph provided by the Centers for Disease Control and Prevention that shows the daily cases worldwide since the 23rd of January 2020 up until the 8th of September 2021. The impact of the crisis across Jordan has been significant. Jordan has been hit hard by the COVID-19 in many ways, economically and socially. At this time, Jordan has over 800,000 cases of coronavirus and above 10,000 deaths caused by it. Another graph that is shown was provided by Google and shows the daily cases of COVID-19 in Jordan. I interviewed His Excellency Dr. Saad Jaber, the former Minister of Health, about how Jordan has been affected by the COVID-19 pandemic. Good afternoon, Your Excellency. Kindly allow me to introduce you as His Excellency Dr. Saad Jaber, the former Minister of Health of Jordan, a prominent consultant, cardiovascular surgeon, formerly with the Jordanian Royal Medical Services, and is currently in his own private practice. Your Excellency, thank you from me and from many other Jordanians for all your hard work, sleepless nights, tough decisions, and tireless efforts fighting off the COVID-19 pandemic before the world even knew of its vaccines or remedies. I thank you as Jordanian, and I am proud to be meeting you here today.
Thank you very much. You are most welcome, you and your friends.
Dr. Jaber, let me start with my first question. What was in your thought process in the first few weeks of the pandemic?
Well, it was a tough time. Nobody knew exactly what kind of pandemic we are facing. So the thoughts I had, how to prevent this pandemic from entering Jordan. And the other thing, are we ready to deal with such an endemic in case it spread throughout Jordan and affect thousands of Jordanians? How can I be ready? How can the country be ready? So it was mixed thoughts, how to prevent, so we closed the borders, how to prepare, so we opened new hospitals, new critical care units, training doctors and nurses how to deal with this pandemic. We didn't have enough masks at the first few weeks of the pandemic, but by 6 months we were producing 10 million masks a day.
My next question is, when did you start preparations for the pandemic, and what were your first moves?
Well, we started preparation for the pandemic even before it was claimed as a pandemic. We started working on the 22nd of January, before the disease completes its first month. It started by the end of December in China. We started preparing for the disease by the 22nd of January. And my first move was to put thermal detectors at all the borders of Jordan, the airports, ground crossings, border crossings, and to start to prepare to make a quarantine hospital. Yes, these were my first move. That was before the end of January 2020.
Yes, thank you, sir. When do you see COVID-19 becoming a memory?
I'm not sure, but I think we started living with it. Countries that have vaccinated more than 60% of their population have opened their economy and they are returning to normal life. Yes, we still lose people, but the number is decreasing. I'm not sure when, but we will live with this pandemic for the coming 2 to 3 years at least.
Thank you. What can we do to prepare for the next pandemic?
Well, I think our preparedness is better, but this won't be the last pandemic the world will face. So, preparing the hospitals to receive patients, having critical care units in increased number, having critical care doctors, and to be able to produce the PPEs, the personal protective equipment that doctors and nurses need. We are now in a position to produce them and even to help friends if they need. So our capability, this pandemic has been a good lesson for us as a country, how to prepare for such and how to act in case of pandemic.
Yes. That concludes my questions. I really appreciate your time, but before we close, is there anything relevant that you wish people to know? Any messages or advice?
Well, yes, I would like everyone to get vaccinated. It decreases the harmful effect of COVID-19, especially on elderly and immunocompromised young and old people. Thank you very much.
Thank you very much, Doctor. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. At the moment, 31% of the Jordanian population has been vaccinated. 3.14 million people have been fully vaccinated. I interviewed Ms. Zaina Sahyun, Chief Marketing Officer, MedLabs Consultancy Group. I am here today with Mrs. Zaina Sahyun, the Chief Marketing Officer in MedLabs Consultancy Group. Thank you for taking the time to meet with me today. To briefly introduce Mrs. Sahyun, Mrs. Zaina Sahyun holds a bachelor's degree in molecular and cell biology and a master's degree in biotechnology research from the University of Kent, the United Kingdom. Let me start with a question about vaccines. What is a vaccine?
The vaccine is basically a kind of medicine that helps train your body to be prepared for an invasion from a bacteria or a virus that your body hasn't yet met. So that when or if you get exposed to that virus or bacteria, your body's immune system is ready to fight it efficiently and you don't get too ill to the point of hospitalization.
Thank you. How does a vaccine work?
So a vaccine works in the same way that your immune system works. So if we take a step back and look at our immune system, we have millions of viruses and bacteria around us, on us, but most of them are harmless. But of course there are some that are harmful, and sometimes these harmful ones manage to penetrate the barrier of protection that we have naturally, our skin and others, and get into our bodies. Once they're in, our body's immune system recognize them as foreign invaders. And they recognize them as foreign invaders because these bacteria and viruses have unique structures on their surfaces, proteins or sugars, that don't exist in any other cell in the body. So they're immediately recognized as a foreign body. And what that does is it triggers our white blood cells to make antibodies in huge numbers. And sometimes it takes a few days, which is why you'll get a fever if it's the first time you're exposed to a virus, while your body is quickly ramping up an army to recognize, not just recognize, but it's kind of like a lock and key to identify the protein that's say on the surface of the virus and create a match antibody that sticks to it perfectly to then kill it or disable it. So there are 4 types of vaccines. The first one is the one we mentioned, which is the attenuated or the dead virus that goes into our body and tricks our immune system into making the antibodies needed. The second is a vector vaccine, which basically uses a harmless virus to carry the genetic material of the scary virus, right? Puts it into our cells. Our cells take that DNA and RNA and replicate it and create this antigen, and immediately, but it's harmless. and then immediately our immune system responds and again creates antibodies. The third one is the mRNA or DNA vaccines, which is like the Pfizer one that's available in Jordan. And in that case, what they do is, again, they implant the DNA, the vaccine uses our own factories, our own cells to manufacture the antigen, and then again our antibodies recognize it and mount a response so that we have the antibodies in us. And the last one is the protein subunit one, which takes fragments of the pathogen, like the protein on the surface, and introduces that to our bodies. And again, our antibodies then just recognize that part, so that there's an immune response, and next time we're exposed to the virus, those antibodies in our bodies are already ready to recognize that part and attack the virus effectively.
Thank you. Very interesting information. Why is it important to get vaccinated?
I mean, it's important to get vaccinated because, I mean, not just in the case of corona, obviously we take vaccines when we're infants, we take vaccines when we're children, is to give our bodies a head start to protect themselves from dangerous pathogens, viruses and bacteria. When you get exposed to a virus as deadly as we've seen corona is able to be, I know in some cases it's mild, but in other cases it's lethal. By the time your body is ready to really fight that virus, or has mounted enough of a response or created enough antibodies to overwhelm the virus, it can take a really heavy toll on the body. For some people it's hospitalization, and some people it's death. So we need to take these vaccines to protect ourselves in case we come into contact with COVID or others. And not only that, we protect ourselves, but in protecting ourselves, if you're vaccinated and you're exposed to the virus, your body very quickly recognizes it and very quickly defends you. So you don't necessarily catch it or carry it. You get rid of it so quickly that you're not going to get the symptoms, the coughing and the tiredness, and especially the sneezing and the coughing. So you're less likely to then pass that virus on to somebody else who's weaker. So the more of us who are vaccinated, the more protected we are overall.
Now, what can we do to prepare for the next pandemic?
The best thing to do to prepare ourselves, in my opinion, is to really take our immunity seriously. And when I say take our immunity seriously, I mean holistically. So when you have a strong immune system, you are better able to fight any viruses or bacteria that you come into contact with. And having a strong immunity depends on 5 main things. One is healthy lifestyle in terms of nutrition and exercise. Also, good sleep, good mental wellness, so mental health, it's very important. And finally, preventive medicine, which is what we do at MedLab. So we really, really preach the importance of getting a checkup once every year, depending on your age, depending on your medical history. Just, make sure that your body is functioning at its best, so that there's no weak points that will bring down your immune system should you be exposed to a virus or a bacteria. So keeping a really good general healthy body and keeping up your immunity is key.
Yes, thank you. Now, to end this off, do you have any thoughts or advice you would like to share?
I mean, aside from what I said about immunity, I would say for the time being, I think it's too early to completely throw caution to the wind and stop wearing our masks and stop a little bit of social distancing. My 2 cents right now is to remain cautious, to remain mindful of our behavior, to be careful of large crowds, to wear our mask where necessary, wash our hands, follow all those instructions that were given previously, and get vaccinated if you're not vaccinated, and especially if you haven't had disease before, and just keep up to date, keep reading, keep aware, and keep educated.
Thank you.
You're welcome.
And again, thank you very much for meeting with me.
Thank you for inviting me to interview. Good luck.
Getting vaccinated is very important. I encourage you all to get vaccinated. If not for your health and safety, think of the weakened immune system people. Think of the children around the world that just want to go to parks. Think of the grandparents that just want to see their grandchildren happy. Think of all the people in the workforce that just want to go about their jobs. Think of everyone. We are all standing together. Go get vaccinated. I would like to thank you all for watching this documentary, and hopefully you can take this video into consideration.